Hi, my name is Dr. Jedrzejewski, and I'm here today to talk to you about body contouring for feminization. We'll talk about, Hi, my name is Dr. Jedrzejewski, and I'm here today to talk to you about body contouring for feminization. So our initial consult will be either over the phone, through video, or in person. We'll talk about what to expect in terms of your operation, but also how to prepare best for surgery and what to anticipate in terms of recovery. The most important thing we'll do is review your medical history. I encourage you to be as transparent as possible regarding your medical and social history so we can address your concerns and work with you to move forward with surgery in the safest way possible. My number one priority is to ensure your candidacy for safe surgery and to optimize your surgical outcome. This means reducing risks of things like wound healing issues, bleeding, adverse reactions to anesthesia, and other complications. In terms of bleeding, we'll look at your medications and make sure that you're not taking anything like an NSAID, like aspirin, ibuprofen, naproxen, because those can increase your risk of bleeding if you take them close to the time of your operation. We'll probably ask you to stop taking them about a week before surgery. Tylenol is okay to keep taking, as that does not increase your risk of bleeding. Smoking or nicotine use of any kind, including vaping, will ask you to avoid 6 weeks prior to surgery and 6 weeks following. We ask you to avoid nicotine because nicotine constricts tiny blood vessels that we rely on to help you heal after surgery. In terms of weight, I do not have a strict BMI cutoff for body contouring and feminization. But it's important to know that with higher BMIs comes a higher chance of needing revision, problems with anesthesia, and if you have any comorbidities like heart and lung problems, these will need to either be resolved or optimized by your primary care physician prior to surgery. And it's important to know that having a stable weight at least 3 to 6 months before surgery will help yield the best aesthetic outcomes for you. If you have type 1 or type 2 diabetes, we'll want to get a recent A1C level to make sure that your blood sugar levels are not too high, because if they are, they can lead to problems with wound healing and increase your chance of infection. If you have any autoimmune issues, we'll look at the medications you take for them. And if they include steroids, we may ask you to stop those around the time of the operation, as steroids can inhibit wound healing. If you have HIV, we'll want to make sure your CD4 count is appropriately elevated and that your viral load is appropriately suppressed. Any personal or family history of blood clots or adverse reactions to anesthesia will be incredibly important to know so that we can help keep you safe during surgery. I'll want to know about any allergies you've had to drugs or medications or foods in the past. I'll want to know about prior surgeries that you've had, especially about prior scars in the abdomen or any history of infection or prior implants or silicone injection into the buttocks. We might have to get a CT scan, which is a certain kind of imaging that allows us to see how your soft tissues look inside of your body, if you have a history of hernia or if you've had any abdominal operations. In terms of social support, surgery is a physiologic stress on both the body and the mind. It's not uncommon to have feelings of negativity, depression, and anxiety postoperatively. Studies have actually shown that the strength of one's social support network can significantly enhance recovery after surgery. Everyone's social support might look different. Some people have family, friends, chosen family, mental health care providers, but it's important to have a plan in place for who's going to support you as you recover from surgery. If hormones are a part of your gender expression, it's best to wait about a year after initiating estrogen so that the majority of the fat redistribution that will occur has occurred. This allows for optimization of the contouring and reduces the unpredictable nature of future tissue deposition. Before moving on to the physical exam, I want to know what your goals are. The most popular procedure for body feminization involves transfer of fat from the abdomen and flanks to the hips and the buttocks. You may have heard of it referred to as a Brazilian butt lift or 360 liposuction. Our goal would be to create a waist to hip ratio, which is closer to 0.7, which is culturally considered more feminine. Abdominoplasty or tummy tuck might also be a component of your feminization, as will things like brachioplasty, if you have extra skin and soft tissue of the arms. Some people don't want any fat re-injected, they just want it taken out of certain areas, and that's definitely possible as well. It's possible that if you have a low BMI, we might actually ask you to gain weight before surgery to help us achieve your goals. We need to be realistic regarding expectations, which might include several rounds of fat grafting or opting for silicone implants if you don't have enough fat for us to harvest. My goal is to help you fulfill your goals and to tailor your operation to align with your embodiment goals. So the risks of body contouring surgery are similar to any surgery, including pain, infection, scar, including hypertrophic scar and keloid scars, asymmetry, contour deformities, dog ears in terms of abdominoplasty, which is extra skin at the edge of your incisions, hyper or hypopigmentation, dehiscence, which is separation of your incision, delayed wound healing, numbness, hypersensitivity, bleeding. There's a 5% risk of having bleeding that would require a return trip to the operating room. There's a risk of hematoma, which is a collection of blood, a seroma, which is a collection of fluid your body makes anytime you make a space that wasn't there. And usually those will resolve on their own, but sometimes they require intervention. There's a risk of damage to surrounding structures with any kind of surgery. There's a risk of needing additional procedures. And there's risks of anesthesia, including blood clots to the legs and the lungs, and even death. There's a risk of regret for various reasons. We can talk more about that in person if you have further questions, but it's important to know that the existing literature shows that the risk of regret for gender-affirming surgeries is less than 1%. And when seen in context of other operations that are elective but non-cosmetic, such as a knee replacement, people who have a knee replacement have a 10% risk of regret when it comes to that procedure. So the risk of regret for gender-affirming procedures is quite low. There's risks of silicone implants, which include risk of infection, extrusion or coming out, contact and being in contact with the outside world, failure of the implant, rupture, malposition, or desire to take it out in the future. So 1 to 2 weeks prior to surgery, we will have our preoperative visit, either over the phone or in person. We'll review the surgical plan and you'll receive prescriptions for your pre and post-operative medications for pain and nausea. It would be great if you could show me ideal pictures of what you hope to achieve with body feminization, so we can make sure that we're on the same page and that our expectations are realistic to achieve our goals. On the day of surgery, you'll arrive about 2 hours prior to surgery start time to either our surgery center or the hospital, depending on where your case is scheduled. You and I will meet in the preoperative area. We'll sign a consent that says we agree on what procedures you're giving me permission to proceed with. And I'll do some markings on your body before we escort you to the OR for surgery. So surgery lasts about 2 to 4 hours. The first part involves removal of fat through liposuction. We make 5mm incisions within natural creases that we can find either on your hips or your belly button. And we also use those incisions to harvest fat for transplantation from other parts of your body. So it's entirely up to you regarding where you want us to remove fat. Generally, we take it from the abdomen and the flanks to help cinch the waist. We'll take it from the upper, mid, or lower back. We'll take it from the inner thighs, the upper arms, anywhere you feel that you have fat to give. And if you're not sure, you can ask my opinion and I'll let you know what I think. The fat is then washed and processed for injection into the areas where we want accentuation, usually the hips and the buttocks, to achieve an hourglass feminizing effect. You'll have stitches placed at the incision sites that will be covered with a dressing, and you will have drains in place to remove excess fluid from the operation. Abdominoplasty may be required to remove additional skin in addition to fat. And we typically use an incision that goes hip to hip in this case. But it's also possible that we might not do abdominoplasty at your first stage of fat grafting. We may do it at a later stage. So you'll wake up from surgery with a faja, which is a compression garment that helps apply pressure to the correct areas of your body. You'll be injected with long-lasting numbing medication during surgery, which will give you pain relief for about 12 hours. We'll give you a small narcotic prescription in addition to scheduled Tylenol and ibuprofen, as long as you don't have any contraindications to these medications. You'll spend at least one night with us in recovery to make sure that you've cleared all the anesthesia and that your pain is under control. If you do not live locally, we ask that you stay in the Bay Area for at least a week following surgery. Immediately post-op, you'll feel very sore. Bruising is normal, and you might have small audible fluid collections. But as long as these are not rapidly growing, it's okay to let them resolve on its own. We'll remove your drains once there's no more than 20 mils per day per drain. It's important to maintain your nutrition during recovery and to minimize constipation with stool softeners, especially while you're on narcotic pain medication. You may start silicone scar treatment once your incisions are fully healed, or as soon as 3 weeks post-op. You can buy these scar silicone treatments online. Keep in mind that your scars will look red and raised for at least 3 months, and then slowly begin to soften, flatten, and lighten over the course of the year. If you begin to develop thick, ropey scars, we can intervene early with steroid injection to help resolve this. In terms of activity restrictions following body contouring, we would like you to maintain the compression girdle called a faja for at least 4 to 6 weeks following surgery. It's okay to take it off to wash, but it's really important to help reduce swelling and pain in the postoperative period. No sleeping on your back or sitting if you've received fat transfer to the buttocks. Of course, you can still sit to use the restroom and you may need to sit to travel home, but there are ways to optimize this, like, for example, standing during a flight or stopping frequently on a long car drive. Lymphatic massage may be helpful in terms of reducing swelling postoperatively, but you should expect to see final results around 6 months post-op. After 2 weeks, you can return to a desk-type job. If you have a more physical job, wait until 4 to 6 weeks until returning to work. No submersion into water like a bath or a jacuzzi until 6 weeks after surgery. If you use nicotine 6 weeks prior to surgery, you may not resume until 6 weeks after surgery, but hopefully you can use this opportunity to avoid restarting and improve your overall health. Your scars will take 12 months to fully mature, and it's important to use sunscreen on them anytime they are exposed to sunlight. In terms of follow-up, after the initial post-operative appointment, I will see you at 6 to 8 weeks post-op and then at 3 months post-op to make sure your healing is on the right trajectory. We would love to see you again at 1 year post-op, either in person or virtually, to assess your final result. At the time of our consult, I will answer any questions you might have. If you have questions that arise after the consult, you can always contact our office and we will be happy to provide you with more information. We also encourage you to submit ideal photographs of what you envision for your results so we can make sure we're on the same page at your preoperative appointment. Following the consult, my team will begin the insurance authorization process and will contact you within 2 weeks to discuss timing of surgery or any other items that still need to be completed prior to surgery, like letter of support by a mental health provider, for example. Thank you so much for taking the time to review this consult for feminizing body contouring, and I look forward to meeting you.